Dr. Kenneth Rogers.
And Dr. Rogers, would you please tell us a little bit about what this new hospital will have in the line of beds and services?
This will be a 120-bed hospital. We're going to start initially with 65 beds. Currently, Marshall Pickens has 46 beds. We're going to expand that number from 46 initially to 65 initially. Some of the things that we know we're going to do up front is we know we need to expand our child and adolescent services. We only have 6 beds currently. We'll probably triple the size of our child and adolescent program. We'll also begin to develop alcohol and substance abuse treatment services, which we currently don't have in our current facility. And so that will be the next thing that will happen with those services. We'll continue to have general adult inpatient services. We'll also have an inpatient partial hospitalization programs that currently exist that will probably end up expanding to some degree.
Okay, and what you mentioned that you will have services for children and adolescents, and you're going to start off with 65 beds to begin with. Where will this be built, and how long will it take for it to be completed and to move up to the full 120 beds?
It's going to be built here on the campus at Greenville Memorial Hospital. It's going to be on the site of the old Blood Connection building, which is going to be the first entrance to GHS off of Grove Road. We're expected to open in 2018, so we're hoping that mid to late 2018 we'll actually be in the new hospital.
Will it change anything going on in Marshall Pickens Hospital, or is it?
Well, Marshall Pickens, once we open the new hospital, Marshall Pickens will actually close, and everything in our operations will move to the new hospital.
How many beds are in Marshall Pickens right now?
46.
46. And have you done a needs assessment where you can see 120 beds will meet this community's mental health needs?
Yes, we actually started planning this about 7 years ago, where we looked at the community, what's our level of need, what are the services that we currently don't have, and that needs assessment really led us to, do we renovate our current hospital and make it more modern? It was built in 1967, so it needs a lot of updating. And so the decision was made to build a new hospital. And at that point, we decided to partner with Acadia Healthcare because of their expertise around behavioral health issues and their ability to run psychiatric hospitals that they have around the country. And so that partnership will help us develop additional services that we're looking at this point. We'll continue to really optimize some of the services that currently exist and think about how to make those more efficient and really figure out how to get those more accessible to the community.
Thank you very much, Dr. Rogers.
All right, you're most